Today, I want to talk to you about a very common question that I get asked from some of my associates or other dentists as well, which is they have a patient is a child, and this child is grinding their teeth at night. And what is the best advice to deal or manage that? First, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa in Harvey Bay in Queensland. And I took it from 1 chair to 10 chairs, from 3 staff members to 40 staff members over the course of 14 years. And you can check my details below for credibility. So in my practice, I do a lot of orthodontics and I see a lot of children as well. And something that I've learned early on when I did my courses with Dr. Derek Mahoney in Sydney back in 2007 is we used to believe that when a child is grinding, is mainly due to some sort of an anxiety or emotional stress that something's happening in the household, and the child is reacting to this by grinding their teeth. And sometimes you can have patients as early as 3-year-old or 4-year-old grinding and wearing down their teeth. What I've seen in my practice and what I've learned, the first thing to screen for is airway. I find that from what I've learned myself, if the child cannot breathe properly at night, so something blocking their airway, could be adenoids, turbinates, tonsils, the sides of the jaw, where the jaw is sitting, and they can breathe well, the body responds to that by stress, yes, but also by trying to move the jaw back and forth and right and left to open the airway. Similarly, in first aid, when someone faints, the first thing you do is to push the jaw up. Same thing. If the child is sleeping and cannot breathe well, they will move the jaw around trying to open the airway or trying to arouse and wake up so they can breathe and then get into a state of sleep again. So for me, the first course of action I would take if a child is grinding is getting their airway checked and assessed by an ENT specialist, but not just any ENT specialist. You need to find an ENT surgeon or specialist who understands the relationship between nasal and oropharyngeal airway and facial development. Some ENT surgeon will give their advice based on if there's current infections or current problems with the tonsils or the adenoids, but they tend to, I wouldn't say ignore, but downplays the relationship between nasal breathing or mouth breathing or lack of breathing and facial growth. So for me, I use an ENT surgeon in Sunshine Coast who's very experienced with dealing with children, and he understands this relationship quite well. And 9 out of 10 of the cases I've seen would have airway issues, and when the airway problem is managed, they stop grinding and they breathe better. They establish better nasal breathing. Now, if the airway comes clear, second thing we probably start talking to, maybe organize with a GP to look at any emotional issues that's happening at home. Any issues with there's some studies showing some parasitic infections as well. So getting some medications or checked for parasite infection as well can lead to grinding as well. Sometimes could be occlusal problems as well. But what I've seen in my practice most commonly would be children with airway. Now, if the airway is clear and there is no problem with parasitic infection, it's purely by emotional problems, and these problems still under trying to resolve at home, what you can do in trim, you can use some sort of appliance like a myobrace appliance or a similar appliance where they can wear it at night. And this appliance you can change in size as they grow instead of making them a night guard or night splint, which can control their growth. But this kind of appliance, you can get it in different sizes. You measure the width of the incisors, and you can get different sizes, so you can change it every like 6 months or so. And at least they can sleep with that appliance to help them protect their teeth a little bit more. So the other question as well, what if they already said they have seen an ENT surgeon before, they had their adenoids taken out, or they've been given the advice that everything is okay, nothing wrong with the airway? My suggestion is to know who is the surgeon and then try to understand whether this surgeon as well deal with a lot of children and understand the relationship between nasal airway and facial growth. If the answer is no, perhaps get a second opinion from another surgeon. Surgeons work differently and diagnose differently, and their advice also based on their clinical background. So it will be wise to get a second opinion. So the last thing, of course, which could be controversial, whether there's a narrow maxilla, narrow arch, and this child needs a little bit of expansion, a little bit of arch development, but that's a controversial topic. So my advice is always screen for airway. One more thing which is very important, should you get a sleep study for a child, the advice I received from my NT surgeon, Dr. David McIntosh, is number one, a sleep study for a child is a long waiting list and it's really hard to access that service for a child. Number two, most sleep apnea in children is not central sleep apnea, but more obstructive sleep apnea. So it makes sense to get the ENT checked first, or the nasal airway or oropharyngeal airway checked by ENT before organizing a sleep study, because most of the sleep disorders will be related to obstruction. So it's better to send them to a surgeon, get this checked, rather than organizing a sleep study for a child, and let the surgeon decide whether they require a sleep study or not. If you find this information helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.